Use of alprazolam. Alprazolam is a prescription medication that belongs to the class of drugs known as benzodiazepines. It is commonly prescribed to treat anxiety disorders, panic disorders, and occasionally depression. Alprazolam works by increasing the activity of a neurotransmitter in the brain called gamma-aminobutyric acid, which helps to calm the central nervous system and reduce feelings of anxiety. Dosage of alprazolam. The dosage of alprazolam prescribed by a healthcare provider will vary depending on the individual and the condition being treated. The following are general guidelines for the recommended dosages of alprazolam. For the treatment of anxiety disorders, the usual starting dose is 0.25 mg to 0.5 mg taken orally 3 times a day, with the maximum recommended dose of 4 mg per day. For the treatment of panic disorders, the usual starting dose is 0.5 mg taken orally 3 times a day, with the maximum recommended dose of 10 mg per day. Dosages may be adjusted by a healthcare provider depending on the individual's response to treatment and the severity of the condition being treated. It is important to take alprazolam exactly as prescribed by a healthcare provider and to never exceed the recommended dose. Abruptly stopping alprazolam can cause withdrawal symptoms, so it is important to speak with a healthcare provider before stopping this medication. Mechanism of action of alprazolam. Alprazolam belongs to a class of drugs called benzodiazepines, which act on the central nervous system, CNS, to produce a calming effect. The mechanism of action of alprazolam is similar to other benzodiazepines. Alprazolam works by enhancing the effects of gamma-aminobutyric acid, GABA, which is a neurotransmitter in the brain that inhibits nerve impulses, resulting in a calming effect. Specifically, alprazolam binds to specific sites on the GABA receptor, which increases the affinity of GABA for its receptor, leading to an increase in chloride ion influx into the neuron, hyperpolarizing the cell and reducing the excitability of the CNS. By enhancing the activity of GABA, alprazolam reduces the excessive activity of certain neurons in the brain that contribute to anxiety, panic attacks, and other related symptoms. Overall, alprazolam's mechanism of action involves enhancing the inhibitory effect of GABA on the CNS, which leads to its calming effects and its use in the treatment of anxiety and panic disorders. Side effects of alprazolam. Like all medications, alprazolam can cause side effects. Some of the common side effects of alprazolam include drowsiness, dizziness, fatigue, headache, dry mouth, diarrhea, changes in appetite, changes in sex drive, irritability, blurred vision, memory problems. In some cases, alprazolam can also cause more serious side effects, such as seizures, depression, suicidal thoughts, hallucinations, confusion, slurred speech, jaundice, allergic reactions, such as hives or difficulty breathing. If you experience any of these more serious side effects, you should contact your healthcare provider immediately. Alprazolam can also be habit-forming and lead to addiction if used improperly or for an extended period. Withdrawal symptoms can occur if the medication is abruptly stopped, so it is important to talk to your healthcare provider before stopping this medication. Important advices for taking alprazolam. Here are some important advice for taking alprazolam. Take alprazolam exactly as prescribed by your healthcare provider. Do not take more or less than the recommended dose, and do not take it more frequently than prescribed. Alprazolam can cause drowsiness and impair your ability to drive or operate machinery. Avoid these activities until you know how alprazolam affects you. Do not drink alcohol while taking alprazolam, as this can increase the risk of side effects and potentially dangerous interactions. If you have a history of drug or alcohol addiction, talk to your healthcare provider before taking alprazolam, as it can be habit-forming and lead to addiction. If you experience any concerning side effects while taking alprazolam, such as difficulty breathing, severe dizziness, or suicidal thoughts, contact your healthcare provider immediately. Do not stop taking alprazolam suddenly without first speaking with your healthcare provider. Abruptly stopping the medication can cause withdrawal symptoms. Inform your healthcare provider of all medications and supplements you are taking before starting alprazolam, as it can interact with other medications. Store alprazolam in a secure location away from children and pets, and do not share it with others.